We begin the mouth care system before brushing with a mouthwash that's called Closys. It's called Ultradex in the UK. And this mouthwash interacts with your saliva. And if your saliva is acidic, this is the kind of saliva that promotes really bad oral health. It occurs for women when we are pregnant. We have acidic saliva for 9 months. We are stressed. Our mouth, men and women, often becomes acidic. When we have been eating, especially anything with sugars or carbohydrates, but also healthy foods, even fruits and vegetables, anything that would be like cider vinegar or citrus fruit is acidic. And the cool thing is that this mouthwash interacts even more effectively with your saliva that is acidic. Now, don't go specially acidifying your saliva. That's the trouble with telling people anything about the chemistry. They're trying to make it better. Just realize that I understand your dentist told you not to brush your teeth after meals because of the acidity created by eating and drinking. That is, unless you're using my complete mouth care system, because we address this acidity by utilizing it to our advantage. And so you use this Closys as the first rinse. Now, the company is going to tell you to use more Closys than I believe you need. If you follow their directions, you would probably be using almost twice the amount that I would suggest you use. So the volume that you use for mouthwash can be reduced. I brought these little sherry glasses, relics of England, to show you that you do not need to use this huge volume that every mouthwash suggests. Economize. There's no benefit in more liquid in your mouth. And you would rinse with this clear, completely tasteless mouthwash. You want the sensitive, or in this case, ultra-sensitive Closys. Do not get the latest new Closys mouthwash, which I should have purchased. Maybe we can put a picture up here on this video. It says gum health. It is a completely different formulation. Please don't use it because it will wipe out, it will put us back to zero. It is a dangerous mouthwash for people who have been using my complete mouth care system because it will destroy where we are in our process. We are moving forward every day with my complete mouth care system towards ultimate oral health. I believe I have ultimate oral health. I have no plaque, I have no cavities, no gum disease, no pocketing. My last dental cleaning was 45 years ago. I want you all to follow me, but don't use the gum health Closys. It's tempting, it looks good. Nice design, guys, but a horrible formulation. So please don't use that. Use the ultra sensitive. If you want to know for sure, go to my website, drellie.com, and look at the Amazon links if you want to buy from Amazon. At least look at the pictures. I've tried to do everything I can because they keep changing the labels. Closys company was recently purchased and they're making a lot of big changes and I'm trying to keep up with it. So go to my website for the latest picture of the latest, the one I recommend. So with Closys, you begin. And you want to bathe your mouth with the Closys. It will do all the work for you. You don't have to swish it around or gargle or do anything fancy. Just put it in your mouth and make sure that it bathes every area where you have a problem, particularly a problem of deep cavities or a problem with gum disease. If you have gum disease in your front teeth, make sure you tip your head forward and get that rinse around those front teeth. If you have wisdom teeth that are coming through and beginning to create a problem, perhaps because they're somewhat tipped, then make sure you bathe those areas with this product. It is a great surfactant. It will go everywhere it needs to go. It will take itself down those 7mm pockets. You don't have to jet it down. You don't need a water flosser. That's going to damage the healing mechanism of those pockets. If you have pockets, I prefer you just rinse gently. Let your body do the work for itself. You don't need to do a thing. No need to floss under the gums. No need to use special little brushes. Just rinse gently, bathing your mouth with the Closys, and it will do the work. All you have to do is make sure you time this. It takes 30 seconds for the Closys to react with your saliva. It turns to oxygen in these difficult places, and the anaerobic bacteria of deep cavities and of gum disease hate oxygen. That's how it works. It doesn't kill anything. It just is a beautiful pre-rinse before you brush. That's not what it says on the label. Listen to me and follow my directions and you will get the results you want. And at the end of a minute, stop. Just because a minute is good, 5 minutes is not better. You want to stop when the oxygen has just been released. So time it. I have a clock with a hand going around in my bathroom because I can't time a minute. Some minutes seem to take forever. Some minutes seem to vanish. So make sure that you are timing your minute with the Closys.